Good evening. I'm Liz Roberts Kirchhoff, Associate Dean for the College of Engineering and Science. And I want to welcome everyone here today online and in the chemistry building on the campus of the University of Detroit Mercy. We are so pleased to welcome MSU College of Human Medicine for their health information series here on our campus. This is, I think, our second year of doing this. So we are so happy to do this for our students. We've got students from neighboring universities and some community members as well. And I'm going to hand it over to Arlen Daly, who is going to introduce the speaker for this evening. Thank you. Welcome.
Hello. Excuse me. Hello, and welcome, everyone. It's so great to be here. And thank you, Dr. Liz, Carmen, Gramlin. Thank you as well. Kim, thank you. Thank you to all the people who are here to really get some good information from your peers. We have Dr. Bryanne Standifer-Barrett here as well. She is a College of Human Medicine alumna. She is a native Detroiter. She graduated from King High School. She has done some great things in the community in Detroit, received some great awards, the Spirit of Detroit Award for hosting free health clinics in the community, which is very important. It's a part of the mission of Michigan State University to bring equitable solutions, especially in health, to its community. And Dr. Bryanne is dedicated to doing that. She does that wholeheartedly. She supports our medical campus here in Detroit, specifically in Southeast Michigan, that campus. She also served at Henry Ford Health as the chief residency, which is a very competitive opportunity, but she did it and did it with excellence and vigor. And I'm so glad that she has an opportunity to not only just share her experiences, but also her expertise. So please be delighted to get further acquainted with her as she presents on today. So thank you very much.
Thank you. Thank you, guys. I must take a second and share the screen here. We practiced beforehand, so hopefully it goes just like the practice. Okay. All right. Thank you for having me tonight. I know it's late, so thank you for coming out. We appreciate that. So today we're going to talk about heart health. I'm an internist and this is bread and butter. And the reason I picked this topic is because I figure if I educate the community, it'll honestly make everyone healthy and it'll make my job a lot easier. So today's agenda, we're going to introduce you to a case study. The case study is Bryanne. We're going to learn how lifestyle has a positive effect on your heart health. We're going to learn about the risk factors for heart disease, how to prevent heart damage. And we're going to also talk about things that every doctor wishes people knew. So for people in the audience, true or false? First side, I can always feel when my blood pressure may be high. Just raise your hand if you think that's true. You can always feel when your blood pressure is high. Good job. Who thinks it's false? Excellent. That is false. Diabetes does not affect my risk for heart disease. Is that true or false? Raise your hand if it's true. Y'all smart. We are UAD, right? Okay. So yes, that is false. Diabetes absolutely affects your risk for heart disease. So meet Bree. As you can see, she's over here to our right. She's a mom, a doctor, and a wife. During 2020, she worked during the pandemic, and she used Oreos as a coping strategy. She felt she was too busy to exercise. She didn't cook her meals at home due to being busy, and she enjoyed fast food. She woke up one morning and noticed that she had back pain. Uh-oh. So that's Bryanne. So Bryanne decides to go to the doctor. And when she goes to the doctor in 2022, they do some blood work. The doctor asks, when is the last time you yourself saw a doctor? It had been a while, if I'm being honest. So if you look to the furthest left of the screen there, you'll notice some abnormalities. I'll tell you just so you know. So there's a couple liver numbers. If you look, it says ALT, AST. This is a very common set of labs we order in the office. It's called a CMP, or Comprehensive Metabolic Panel. AST and ALT should not be that high. Those are considered mild elevations in those liver enzymes. When we look at this next test here in the middle, that is called a lipid panel, and it has total cholesterol, HDL, LDL, which are some of the lipoproteins that make up a lipid panel. LDL, as you can see, is 118. It should be less than 100. I'm going to try to shorten this up here so you guys can see everything. And can I move this up? How can I move this up? Okay, I'm not sure. Just do like that. Okay. Oh, there we go. So then when you look to the furthest right here, you see an A1C, and that's at 5.8%. And that is also elevated. That's considered prediabetes. So Bryanne has high liver enzymes. She has a high LDL profile, and she has an elevated A1C. Okay, so this was Bryanne's wake-up call, because what the heck, right? So first step, what is heart disease? So we consider heart disease a couple different things. And I think most people think about heart attacks, but it's so much more than that. The picture here illustrates a blood vessel. So we have blood vessels that go throughout our entire bodies. These blood vessels, if you can imagine, are like freeways. They should be nice and open and clear. But as you can see in this blood vessel, there are little cholesterol bubbles building up that are going to impede blood flow. Whenever you have impedance of blood flow, that leads to disease. That can happen in the brain, the heart, the legs. Other causes of heart disease, arrhythmia. So arrhythmias are the chemical or electrical activity of the heart. When the heart is sick, the arrhythmias can happen, and that can also lead to heart disease. Heart attacks, we talked about. Stroke. This same phenomenon happens in the brain. So blocking blood flow to the brain will lead to stroke. There's also valvular heart disease. So the heart has valves in it that help with blood flow. When the heart is stretched too much, or different abnormalities to the heart wall itself, it can cause valvular heart disease. All of these things make up cardiovascular disease or heart disease. When you looked at the first screen of Bryanne, her blood pressure was 136/90. So she was technically considered stage 1 hypertension. So we talk about blood pressure, knowing that our normal value should be less than 120/80. I think this is really important too, because as a student, we don't think about getting ourselves checked out because we're always trying to be students, right? So making sure that you at least know what your numbers are. I did a couple of health fairs last year where students helped me with check blood pressures on people, and they themselves found out they were hypertensive. They're stressed out, probably not eating the best. All of these things can then lend to high blood pressure, or what we call hypertension. Some preventative strategies. I have this conversation all the time in the office. Dr. Standifer, I don't want to go on blood pressure medicine. What can I do? I'm holistic. What can I do? I don't want to take a pill. I don't want to do it. So a couple of things I always in my practice try to put in holistic measures before I start medication, depending on what the person's numbers look like to start. So number one, weight loss. We talk about this a lot, but when you lose weight, you can actually reduce your blood pressure by 5 points. Eating a healthy diet, we call it the DASH diet, focuses on low salt intake. Following that diet to a T can actually reduce the blood pressure by 11 points. Reducing the amount of salt that we're eating. I know we're eating chips today, but it's okay for today. But you want chips are loaded with sodium. You just want to watch the sodium. It's hitting in a little bit of everything. Case in point, I tried to actually recently change my breakfast patterns. So I call myself getting chicken sausage instead of doing the traditional stuff I was eating. So I got chicken sausages, and I noticed my blood pressure was going up. I check it 3 times a week at work. And I'm like, what is going on? I looked at the chicken sausage package, again, thinking high protein because I lift weights. I'm going to eat these chicken sausages. 3 sausages had over 1,000 milligrams of sodium in it. So sometimes you have to really, really read what you're eating because it's hidden in everything. And then also intaking dietary potassium, which I want to leave a caveat because I don't want people just to go take potassium willy-nilly. You want to make sure that the potassium levels are being monitored because potassium can cause issues with the heart. But it can also, at certain doses, lower the blood pressure too. And then as you can see this plate here, from where I'm from, we don't really eat a lot of veggies. If I'm being honest, my plate didn't look like this growing up. It was more lots of proteins, more carbohydrates. But if you consume more of your leafy green vegetables, lean white meats, if you're a meat eater, and then reducing dairy, this can also help with your diet that can help lower the blood pressure naturally. Okay, so you have high blood pressure. Now what? So we talked about the preventative strategies, stress management. I see so many people who are walking around overstimulated, social media scrolling, all this comparing. We're stressed. We're putting too much on our plate because we're trying to be everything for everybody all the time. So watch what kind of things are in your current environment that can help lower your blood pressure. If you're sitting on too many committees, doing too much, let some stuff go. It's okay. And then again, the preventative strategies. That'll be like the common theme of this whole talk is prevention. Cholesterol. So we saw her cholesterol. The cholesterol was elevated, and that was the LDL. So we talked about the freeway of the blood vessels and how it should be open. And when cholesterol builds up, it forms these plaques that impede blood flow. So cholesterol, our bodies naturally make it. It's a protein. It's a lipoprotein. It's inside of our cells. It's kind of all over the body. It circulates the blood, and it can form these thick deposits. And when we check it, we're looking for LDL. And now there's a new one called lipoprotein A, which we'll talk about that at another lecture. But the cholesterol levels need to be lower so that you can prohibit this sticky substance. And to that initial true and false question about diabetes affecting heart disease, diabetes in itself makes the blood vessels sticky. Cholesterol is already a naturally sticky substance. So you have two sticky things touching leads to more blockages. Cholesterol being high can also be inherited. So I have a lot of medical students I see, they come in for routine screens. We always check lipids on everybody despite guidelines. That's just the way I practice medicine. And you'll see someone coming in where their total cholesterol is 300, LDLs 200. That's very high. Despite them changing their diet, doing everything I asked them to preventative wise, it can still be high. And sometimes that can be inherited or genetic. So make sure when you go to the doc, despite you not being the 35 that guidelines recommend, ask for at least one-time check for yourself. Diabetes. So you saw her number at 5.8%. And people ask me all the time in the office, well, Dr. Standifer, what does that mean? What does an A1C really mean? So an A1C is actually a measure of how well the red blood cells, how much blood glucose is around that red blood cell. And the red blood cells should not have glucose around it. But when it's too much in the body, it will form around and give us this percentage called an A1C. So there's a couple different types of diabetes that we know about. So type 1, you normally present earlier in life because your pancreas, which is the organ that makes insulin, just cannot. And so therefore, you need to substitute your body with the insulin that it's not being able to make. Type 2 normally happens later in life. And that's when the body makes insulin, but the cells have become resistant to that insulin. Prediabetes, which I see a whole lot of, is diagnosed when your A1C is at 5.7. And that, again, can be reduced when we change our lifestyle and our diet. People ask me, well, what does the A1C really mean? On the case study, the A1C was at 5.8. So that means, according to this table, the average glucose at any given time is 129. Blood sugar should be 60 to 100. So anything more than 100 over a long period of time puts you at risk for diabetes. So that's why we care so much about prediabetes. So what can I do? And I think I've answered this question a bunch of different times in the crowd. What can I do? What can I do? So number one, fill your own cup. I always tell my patients, do at least 15 to 20 minutes of some type of activity that pours into yourself because you can't pour from an empty cup. You just can't. You might think you can, but eventually your body will compensate and no longer compensate, and it will give out on you. So make sure you're doing something to make you feel good. Doesn't have to be money. Doesn't have to get your hair done, nails done. That's, to me, that's not self-care. That's more self-maintenance. You want to do something like, for me, I listen to Audible books in the morning before I go to work. I pray. I work out first thing in the morning. Those are things that help me get centered. Consistent exercise. I didn't really understand the importance of exercise. I grew up in Detroit. We weren't taught to exercise. We just weren't. We were taught to do other things, but not exercise, so we want to get at least 30 minutes of cardio or strength training in a day, and really strength training over cardio. The other thing, you have to monitor your vitals at home. As a primary care doc, I can't stress enough, I can't use the one measure in my office to make a true determination of how well someone's sugar or blood pressure is controlled. So realistically, when you go to the doctor, you should have your blood pressures written down. If you are in a situation where someone's telling you it's high, bring those blood pressures to the office so that it can be reviewed between yourself and whoever's providing you care. Reduce the amount of processed foods. I'm on this whole processed food kick right now because if you think about it, I don't know if you do eat anything processed. When you eat processed food, it's truly an empty calorie. And the way it works is you put this food in your mouth, your brain thinks it's getting this big carb load or this big nutrient load, So you eat a burger, for example, from McDonald's. Your brain thinks, oh, okay, I'm about to get this big protein load because I just tasted it through my vagus nerve, right? I'm tasting this big protein rich meal. Goes to your gut doesn't process anything nutritious. So then your brain's like, wait a minute, where did the nutritious food go? What happened? And you become hungry again. So if you notice, when you eat a lot of processed foods, you might feel hunger all the time. And that's a part of their marketing strategy. So kind of watch what you're eating in terms of processed foods, because that was me and those Oreos. Okay, so after a few lifestyles later, blood pressure is going down to 116/72. As you can see, the cholesterol. So she started working out, lost a bunch of weight. The HDL, which is the good cholesterol, which helps to lower the bad LDL cholesterol, went up to 73. So again, when people come and say, well, what can I do to be holistic? Work out, because working out will truly increase your HDL and do a whole bunch of beautiful things for your body. And as you can see, these labs were done in February, and I'm due for another physical next February. So we'll see what we're looking like at that point. But the A1C, as you can notice, it went from pre-diabetes to non-pre-diabetes just with exercise and changing what I was eating and managing my stress. Fatty liver, still kind of there as of February of this year, but we're working on that. So, but as you notice, look at that substantial drop from 72 to 45. So again, fatty liver is another conversation, but that can lead to liver issues, liver failure. We want to try to get the weight down if we can. And the other most important thing, the back pain went away. So here's a couple things that I just wish every single person knew about healthcare. Number one, always keep a list of your home medications along with all the doctors that you receive care from. Like, put it on your person. If not for yourself, have your parents do it, your grandparents do it, so that when they go to a different doctor appointment, they're ensured that they're taking the right medications, especially if you're seeing doctors from DMC, Henry Ford, wherever have you, the computers don't talk. And that goes to my second point. Healthcare staff, we don't have a list of medications or formularies or brands or medical equipment that each insurance covers. So there's a misconception, especially if you watch TV commercials, call your doctor to see if they cover Ozempic. No, call your insurance first, see if you have coverage for Ozempic or whatever med you're trying to get, and then bring it to the doctor. And also knowing which medications and which pharmacies are covered with your plan, because every pharmacy cost is a little different. So if you're on medications, call around. CVS is not always the cheapest. Sometimes the mom and pop down the street is. So call around to different places to see what's available for you. And then not all hospital electronic medical record systems communicate with each other. Like I was saying, DMC uses one, Henry Ford uses one. I'm at a Henry Ford and I can't see the Henry Ford on Grand Boulevard yet. So there's a lot of disjointed communication between the healthcare systems. So it's important that if you're seeing doctors, private doctors, whoever else, have a detailed report and then make sure your primary care doctor knows what's going on. Because primary care doctors, we are literally the quarterbacks. If you don't have a primary care doctor, get one. And God bless my OBGYN colleagues, because a lot of them end up being primary care doctors for their patients. But you do need a primary care doctor. And the last piece of it is, if you're hospitalized, make sure you always follow up with your primary care doctor 7 days after being discharged, because a lot of medications get dropped, new meds are being added. A CT scan was done in a hospital that showed X, Y, and Z. That wasn't the focus of the stay. So the primary care doctor can triage and look to see what's being done and work on that. So in summary, know your numbers. Exercise at least 30 minutes a day. My preference is strength training. You want to, if you smoke, stop. And if you don't smoke, don't start. See a doctor at least once per year, because remember, your insurance will cover at least one preventative visit a year. Ask questions if you have them. Take a notebook to the office. Bring a friend if you're scared. Write notes. Don't feel silly asking the question. If you feel like you can't ask your doctor a question, get a new doctor. My patients, we talk about everything, and that's how it should be. You should have a safe space to bring up all your health concerns. And I think that's all. Any questions so far? Because y'all smart. No questions. Oh, yeah, go ahead.
Have you ever had a patient who was very, very, very active, and you got to the point of medication where you could, or more lifestyle, it was like severe to the point where lifestyle changes or medication couldn't really help the situation?
Yeah, so the question was, what can I do? What have I seen a patient with such severe hypertension, such that it was what we call resistant hypertension, and I couldn't do anything about it? I have, unfortunately, and unfortunately, in my experience, they've been at that end stage where we're talking dialysis, we're talking heart transplant at that point. There's different studies out now. They can do like renal denervations now for people who have resistant hypertension. But I think that's a really good point that you bring up, because so much we think hypertension is, oh, my mom had it, so I have it. You want to make sure that whoever is monitoring your levels and monitoring your blood pressure has checked for what we call secondary causes. Right now in Michigan, most of us are overweight. Most of us are walking around with sleep apnea. So that is one of the highest causes of high blood pressure that I've seen, because people just don't know it's a thing, right? So if you're snoring, waking up with headaches, getting up to pee a lot at night, talk to your doctor. Any more questions? Yes.
Mention the strength training.
So the question was strength training over cardio and why. So strength training actually helps you build muscle. And when you build muscle, you burn fat. The cool thing about strength training, so case in point, I get up at 5 a.m. 4 days a week and I do strength training. So from 5 a.m. to 6 a.m., I'm working out. I burn my calories. Throughout the entire day, I'm continuing to burn calories because I'm breaking down and building muscle. When you do cardio, and you guys are in biochem, you probably are closer to this than me, you burn your glycogen stores after about 30 minutes, right? But you're not continuing to burn calories throughout the day like you will with muscle. The other part is that you want to strength train to help support your bones and joints. So most of us walk around here, we don't have good muscle tone. The bones and the joints rely on the muscles. And so for some who don't have that good muscle support, what ends up happening is that the joints and the bones do all the work, wearing them down, and that extra weight on bones and joints actually causes pressure changes, which we see as arthritis. So when you do muscle strength training, you're actually also building bone as well. So you just get bang for your buck. And I figure if I'm gonna get up at 5 a.m., I want bang for my buck. So, yeah. Anybody else? Any questions? Yes, sir.
Yeah. How do you stay up to date with things that are important for patients? And what should the patient look for in a primary care visit?
Good question. So how do I stay up to date and what should a patient look for in a primary care doctor? For me, I'm the type of doctor and that I love science. Like I told you, I love physiology. So I read papers. I read a paper a day. I get alerts on my phone about new studies coming out. So if I'm not seeing patients, I'm studying still. I go to the library once a week still. Because what ends up happening, and most people don't realize that on the pursuit to medicine and in residency, you're studying. Our whole lives we're studying. So I feel off balance when I don't study, if I'm being honest. And then the second part of your question was, what should a person look for in a primary care doctor? I think from day one, getting that first interaction, seeing if expectations were laid out, seeing if you've understood the way that they practice medicine, being able to ask questions. Do you feel comfortable? Like some people just know, they come in there like, yeah, this is it. Like you just kind of know, you feel it. So I think making sure you can ask those questions is very important. Because so many people I see now, they'll see a doctor for 10 years. They'll come in and see me. Oh, Dr. Standifer, by the way, I can't breathe when I go upstairs. How long has this been going on for? 5 years. But you just saw someone 6 months ago. Did you not bring it up? No, I didn't feel comfortable. So I see that a lot, like a lot. So that I think is the biggest thing, is making sure you feel comfortable with whoever's giving you care.
With plaque buildup in the blood vessels, how do you know, okay, maybe peptide is gonna work, or you might need to do more intensive procedures?
That's a good question. So the question was, with plaque buildup, how do you know whether you should do a procedure to evacuate the plaque, and like, what does that look like? So it's really cool now in 2024, we can do something called CT calcium scoring, where you can do a CT scan and actually take a look in the blood vessels to see if there's plaque already there. So that's like a new cutting edge thing that we can now do. So irrespective of cholesterol numbers, because sometimes the cholesterol panel itself may not be reflective of what's going on in the actual vessels themselves. So we can actually do imaging studies now to get a score, risk estimate, and determine whether or not a person, what their risk is like, essentially. But you're right. A lot of people are walking around with it there already. And the question is, what do we do? A lot of times when the plaque buildup is so substantial, theoretically, you may feel it. But in my world, most people don't feel it. You know, people walk around with 80, 90% blockages and they just walk around. So actually having symptoms is a blessing if you think about it. Any other questions? Yes.
So since I started striving and being a medical like I go to, I've witnessed grievance. And I'm curious what you think of. You'll see what I'm going with. Doctors, at least some that I've dealt, seem to have this like factory or assembling line mentality, where it's like, just crank out the patients and just take them out one by one, 5, 10 minute, 15 minute, if you're generous appointments. And I'm curious though, is the entire like medical field infested with that kind of mentality, or is there hope?
So the question was, nowadays medicine has become more like a factory where we're seeing many people not given direct care, getting them in and out like a fast food or car assembly line. That breaks my heart to hear. I will say, as an employed doctor, as a primary care doctor, and someone heard me say multiple times, I have a real big gripe with insurance right now. Right now in medicine, because the cost of healthcare is so high, and when people are seen by docs, and if you're a doctor that takes insurance, the insurance reimbursement is what you get to sustain your practice. Unfortunately, reimbursements are reducing. So that means my office doesn't look like a dermatology office because it's dermatology and I'm primary care, right? They get a little bigger reimbursement. So unfortunately, with payments being cut, is you have to see more people to keep the lights on. And then on top of that, as a primary care doctor, I see every insurance, right? So every insurance, meaning Medicaid to commercial. So if the Medicaid individuals, there's not a lot of reimbursement, unfortunately, with that. And so some people have to see more to keep the lights on. The way I practice is, and my patients will tell you, you come in, you might not come in right on time because despite this 15-minute appointment, I do my best to give that person what they need. And the reason is because I want to go home and sleep well at night knowing I did the right thing. So even if the appointment says 2:15, you might not come in until 3 because the person ahead of you had 8 things going on that had to be addressed at that time. And so that goes back to that transparency, to the question about a good PCP. I say that, hey, they only give me this amount of time, but I do my best to address all concerns with the time that I have. But it's hard, right? There's a lot on us as docs. Like, you have to be everything to everybody all the time. We live in this microwave society where everybody wants stuff fast. We have these portals where you're sending messages and all this really, really fast. And it's kind of hard to keep up. But I think if a person gets to the point where they look at it as a factory, they should probably switch fields. Yes, sir, in the back.
Well, we think, pouring into yourself and also parenting. What about what part do you think stress plays into, like your blood pressure and also?
So the question was what role does stress play in cholesterol and blood pressure? Oh man, stress will make you think you're having a heart attack. I've seen it. I've literally witnessed someone, I thought they were having a heart attack. I promise, like they had anginal symptoms, the whole 9, and they were overly stressed. And I'm starting to see it more now post-pandemic, as I was talking to them about just how care is now post-pandemic. Everybody's waited, hasn't seen a doctor, and we're dealing with like a backlog of illness because of that inability to get in to see your doctor. But it plays a role in everything. Like stress is the greatest mimicker possible. There's a condition, Takotsubo cardiomyopathy, where you literally look like you're having a heart attack, but it's all from stress. Good question. No more questions? Any on the chat? No? Okay. Yeah.
Do you feel as though being a physician is a political job?
Yes. The question was, do I feel as though if being a physician is a political job? I think I have to think like a lawyer more. My sister's a lawyer. And so I have to think like a lawyer because we live in a culture where people are quick to sue. So documentation is everything. Like for everybody in the crowd that wants to be a doc, the EMR or your medical record system is literally a legal document. So if you were ever to get sued, they're printing out that document. So I find myself sometimes practicing making sure I have everything covered so I do not make myself liable for a suit. So I think more for me, less so political, more so I feel like a lawyer. Like, do I do this? What do they, you're kind of thinking, and it kind of takes away from the art or practice of medicine, but that's where we are now.
So you have your,
I'm employed.
I know I oftentimes, most times the surgery.
I don't. Nope, I don't. And so the question was, do I have a team of an NP or a PA? I don't. And my patients love me. I don't think they'll want to see anybody else. So that wouldn't work. I do. I'm a professor for the college, so I do have students that rotate with me. But no, it's just me. I'm a one-man show. Yes.
Do you see AI impacting how you treat patients or medicine in the future?
So the question was, do I see AI impacting how I treat patients? So actually now AI, Epic, which is the EMR system that Henry Ford has an AI rollout where the AI will listen to the conversation between yourself and the patient and will dictate your note for you. So pretty much like a scribe, which I think is actually great because now I can look at the patient, right? Like before it was, what do you say? What did you say? Like doing kind of one of those, say, hold on, wait, hold on. Like, so you can just literally interface with your patient. So I like it for that reason. there was actually, as an internist, we have American College of Physicians. There was a conference and this year, and the big talk to start was AI and how it's going to affect health. At first, I was nervous. I'm like, oh my God, am I going to lose my job over AI? And in reality, here's why I don't think it's the case, because back in May, my system went through a cyber attack and we were down for 8 weeks. So if somebody cyber attacks the AI, you know what I mean? Like, what? So I think it's great if used correctly. I don't think it can replace, because what I bring to my patients, bar none. Yep. Any other questions? Come on, yeah, do it. No, ask whatever.
That's something that you.
So the question is, how did I integrate holistic practices and when did that happen? So along the way, when I got onto this food journey. So funny story, I looked at bread and watched it mold and different brands of bread I was curious because we left some bread out. It never molded after months. So I did an experiment on it. So I took 8 different brands of bread and I watched them mold. And a lot of the commercial breads took literally weeks to months to mold. And I compared it with my control, which was baked bread that I made from scratch. And that molded after 3 days. So it wasn't until then, in conjunction with this fast food epidemic, that I realized the importance of like supplementation. And then that just kind of grew. When patients come in, you'll learn what you need to know. Like I share with some of these guys in here, I'm actually studying to be a certified menopause internist. So I'm taking another big exam, God help me, next week. But you kind of conform to what your patients need. And then just that, again, being a doc, that scientific curiosity, it never goes away. In fact, I think it is probably ramped up more as an attending because it's just me, right? It's nobody else after me. Med students is the residents. You have the residents. The residents, you have your attendings. Attending is just me. And I'll call a colleague if I need. But yeah. Yep. So it happened after. Mm-hmm.
When you tell your patient, God, the health food well expansion.
Mm-hmm.
So, because I'm big on like good health for all financial stable doing.
Mm-hmm.
So, what do you like? What do you tell them? Like, what is your comfort? Or do you have suggestions of Whole Foods? No, Whole Foods
Is not. Whole Foods, whole check, you mean? So the question was, what do I do in terms of telling people how to eat healthy? What does that strategy look like? So I keep it simple. Lean white meat, leafy green vegetables, randazzo's, shop in the perimeter of the store and not the aisles. Think about it. You don't need nothing from the aisles. Think about it. You don't. So I think it's what we eat, the portions that we eat. A lot of what I see with my patients is, I don't have time. I'm working a million hours. And I think our jobs are killing us. That's a different conversation for a different day. But I think between eating, trying to figure it all out in a busy day, you got kids at home, you just work 8 hours, you're tired. People then tend to go to McDonald's. I mean, it's marketing. That's what they're there for. So what I say for that situation is, okay, instead of going to McDonald's, go to Kroger, go to the prepared food section and get something from there. You don't have to eat the fast food. So it's more so in Randazzo's. You can do a lot with $20 at Randazzo's. You can do a whole lot. But I think it's about changing our palates. Even from a protein source, using chickpeas instead of meat, a chickpea sandwich instead. And I think it's just our willingness to change too. It's really easy and comfortable to stay doing what we're doing. So also, I was here today, so I had a little bit of Faygo. I don't drink pop anymore. I don't eat fast food. I don't, a lot of things that I grew up culturally doing, I don't do anymore because we shouldn't. And I'm at a point now, my body will tell me, nope, don't do that no more. Yep. Mm-hmm.
So do you provide any resources for patients that are interested in maybe changing up their diets? And what do those resources look like?
Right.
For people who like there are patients who just don't know where to start,
Mm-hmm.
what to look at, and they don't have any ideas, and they just need to get some ideas going to get into the groove of like, okay, this is what a healthy plate looks like, and your place I can get it from, and yeah, like, is there any resources that you provide them to help get them into that space?
Sure. So the question was, do I provide any resources to get people into the healthy mind nutrition space? So nowadays, again, post-pandemic, before pandemic, we had a bunch of nutritionists on staff we were able to refer a patient to. Nowadays, we don't have that. So there's a bunch of different resources out, like Use Nourish. I'll recommend to a patient because they accept insurance. Their nutritionist there. I'll use that. I have a good relationship with my diabetic educator nutritionist. I'll ask her to lead a class. Our office actually has bi-monthly education course. People can come in and learn about nutrition that way as well. So I think it's just honestly a hodgepodge of stuff, because the reality is that there's not a lot of money in prevention. And theoretically, you should be able to call your insurance and they should tell you, oh, hi, here's a nutritionist, here's a blood pressure monitor, here's a glucometer. They don't do none of that. So we have to figure it out on our own, if you will.
And some of the AI conversations with medicine, you can actually add ChatGPT to make a meal plan that is plant-based, that is like, or whole food. You can incorporate that into your practice, just like it's you all live, make a grocery list, tell you how much it's gonna cost, where you wanna go. You can do those things as well. But I think just changing your perspective and opening your mind. Great and eating a certain way. But yeah, AI is pretty if you were interested.
So the statement was using AI to create a menu for yourself to kind of take out that third party. Yep. I do that for my kids' lunches. That's the hardest thing to figure out what to pack for a toddler.
I just tell them to eat more vegetables and then like let other things just kind of fall out.
And then you have to define a vegetable, right? Because I had people who heard me say that and went ham on potatoes, and now we're gaining weight and our potassium is up.
Now cabbage, broccoli, kale. You know what I mean? Go from there.
Yep. I know. Any more questions? All right. Good. All right.